Hello everyone. In this video, I am going to talk about Buspirone. Buspirone is an anxiolytic available under the brand name Buspar. It is one of the aza-spirokedone derivatives. That's why we can see the suffix spirone in its name. This drug is indicated for the short-term treatment of generalized anxiety disorder. GAD is associated with an unknown cause and symptoms like intense fear, irritability, fatigue, and a lack of sleep. Generally, many types of drugs are available to treat GAD, such as SSRIs and SNRIs, which are actually intended to treat depression. But within the anxiolytics category, benzodiazepines are well-prescribed drugs to treat various anxiety disorders, including GAD. But benzodiazepines produce few of the side effects that are not easily tolerated by patients. They produce sedation and muscle paralysis, which impair the patient's daytime activities. So while taking benzodiazepines, patients should be cautious when driving vehicles or working with machinery, as benzos can produce drowsiness, confusion, and sedation. They also induce amnesia, the loss of memory of current events, which is more troublesome in elderly patients. Another limitation with benzodiazepines is the tolerance observed with these drugs. On repeated administration, the anxiolytic response may be reduced with benzos, which makes it necessary to adjust the dose to still higher amounts, leading to more pronounced side effects like sedation and muscle paralysis. Even though benzos are not as addictive as opioids, they can still cause dependence and result in withdrawal symptoms upon sudden stopping of the dose. Buspirone shows few advantages over benzodiazepines in these aspects. It has no significant sedation, like benzos, so it may not impair daytime activities very significantly. Of course, it can cause dizziness in the patients, which can be tolerated well and is not that troublesome. Buspirone doesn't produce muscle paralysis, so it will not impair any motor performance as observed with benzos. Another important advantage is that it neither shows tolerance nor dependence. So comparatively, Buspirone shows fewer adverse effects than benzos, but it still does not win the game. The bus of Buspirone has few stoppers on the road. One of the limitations of Buspirone is its slow onset of action. It takes at least 2 to 4 weeks of treatment to show any beneficial anxiolytic effects in the patients. Due to these delayed pharmacological actions, Buspirone is not effective for the acute treatment of anxiety. But benzodiazepines can show an immediate response, so they are suitable for acute treatment. Another limitation of Buspirone is that it is only useful in the treatment of generalized anxiety disorder and is not effective in the treatment of social anxiety disorders and phobias. In spite of these limitations, Buspirone can still be used for the treatment of chronic anxiety states like generalized anxiety disorder with a low side effect profile. In this video, I am going to discuss how Buspirone works as an anxiolytic, how to take this drug, what to avoid, and more common side effects observed with the use of Buspirone. Let's start our discussion with the mechanism of Buspirone and how it acts as an anxiolytic. Buspirone acts as an agonist on 5-HT1A autoinhibitory receptors, which are expressed on the soma and dendrites of serotonergic neurons. It also has affinity for 5-HT2 receptors, which are expressed on postsynaptic neurons. To a lesser extent, Buspirone also acts on dopamine D2 receptors. The exact mechanism of Buspirone is still not clear, but its anxiolytic activity is highly attributed to its activity on 5-HT1A receptors. 5-HT1A receptors are of two types. They are expressed as inhibitory autoreceptors and postsynaptic heteroreceptors. These autoreceptors are highly expressed within the raphe nuclei, controlling serotonergic transmission. They are expressed on the soma and dendrites of serotonergic neurons, where they control the release of 5-HT. These receptors play an important role in the induction of anxiety, and they are a good target for drugs like Buspirone. Heteroreceptors are more abundant in corticolimbic pathways, and they are expressed on postsynaptic serotonergic neurons. They play an important role in controlling emotions and may be better targets for controlling depression. Now, the anxiolytic activity of buspirone is mainly related to 5-HT1A autoreceptors that control somatodendritic transmission within the serotonin neurons. Buspirone acts as an agonist on these receptors, resulting in an inhibitory effect that leads to a decreased release of serotonin. This is the initial effect produced by buspirone in the early days of treatment, and as the release of 5-HT is reduced, it results in an increased anxiety state in the patients, which is observed in the first week of treatment. But with chronic use of buspirone, these 5-HT1A receptors become desensitized due to repeated binding and activation of these autoreceptors. This takes around 2 to 4 weeks, after which, these autoreceptors are no longer working properly so that buspirone can't bind to them and activate them. Now, due to the loss of inhibitory receptors, the control over 5-HT release has been removed, leading to enhanced 5-HT release. This improves symptoms in the patients by reducing tension and fearfulness. Due to these delayed pharmacological responses, buspirone shows a slow onset of action in anxiety disorders. Now let's see how to take this buspirone. The initial dose of buspirone is started at 7.5 mg, given twice daily. Food increases the absorption of buspirone, so the levels of this drug may vary based on how it is taken. That's why it is better to follow the same method of intake to maintain consistent plasma levels each time. If it is taken with food initially, it is better to take this drug every time with food throughout the course of treatment. It can also be taken without food, but the same time of intake should be maintained each day of treatment. The initial dose is 15 mg per day, which can be taken either as 7.5 mg twice daily or 5 mg 3 times daily. Dose can also be increased at increments of 5 mg in case of no significant reduction of anxiety after a few days of the treatment. A daily dose of 20 to 30 mg per day is the recommended dose for better therapeutic efficacy. To reduce the severity of the adverse effects, the dose of buspirone shouldn't exceed 60 mg per day. Now let's see the precautions for buspirone. Buspirone and benzodiazepines are both drugs that can be used to treat anxiety, but they are not similar chemically or pharmacologically. Buspirone affects 5-HT levels, whereas benzodiazepines increase the action of GABA. So, when benzodiazepines are replaced with buspirone, the dose of benzos shouldn't be suddenly stopped, as it may precipitate withdrawal effects. So the sudden replacement of benzos with buspirone may result in the development of some of the symptoms, like irritability, insomnia, anxiety, agitation, tremor, and muscle cramps, which are not controlled by buspirone. Therefore, even with the start of buspirone therapy, benzos shouldn't be suddenly withdrawn, and the dose should be slowly tapered to reduce withdrawal effects. Another important precaution with buspirone is the restlessness caused by this drug. This effect is due to its action on dopaminergic neurons. Buspirone can block dopamine D2 receptors, resulting in extrapyramidal side effects, like akathisia, which is more pronounced in the first few weeks of the treatment. Buspirone can be taken with food, but along with grapefruit juice, it should be carefully taken. This drug is metabolized by the CYP3A4 enzyme, and grapefruit acts as a CYP3A4 inhibitor, thereby inhibiting the metabolism of buspirone. A large intake of grapefruit juice may elevate the plasma levels of buspirone, leading to its toxic effects. That's why high consumption of grapefruit juice, along with buspirone, should be avoided. Similarly, the sedative and depressant effects of alcohol are further enhanced by buspirone, so they are best avoided with the simultaneous intake of alcohol. Now let's focus on the adverse effects of buspirone. One of the important side effects of buspirone is dizziness. Within the brain stem, locus coeruleus releases norepinephrine, which plays an important role in maintaining arousal and wakefulness. Buspirone had additional inhibitory activity on the locus coeruleus, resulting in the development of lightheadedness in the patients. It can also cause drowsiness, headache, nausea, and insomnia, among other important side effects. Restlessness is another side effect observed in the first few weeks of treatment. Interactions of buspirone. Buspirone shouldn't be combined with monoamine oxidase inhibitors as it results in the development of serotonin syndrome, leading to an elevation in the blood pressure. So MAO inhibitors, like phenlazine, isocarboxazid, and tranylcypromine, shouldn't be combined with buspirone. Similarly, selegiline is a selective MAO-B inhibitor that can precipitate serotonin syndrome with buspirone, hence, it should be avoided. Few of the drugs show additional inhibitory activity on the MAO enzyme, so they can also elevate blood pressure when given with buspirone. Linezolid is such a drug that belongs to the category of antibiotics with weak MAO inhibitory activity, so it shouldn't be co-administered with buspirone. Buspirone is mainly metabolized by the CYP3A4 enzyme, and drugs that affect the activity of this enzyme may result in an alteration of plasma buspirone levels. Strong inhibitors like ketoconazole and ritonavir may increase levels of buspirone by reducing its metabolism. In such conditions, the dose of buspirone should be reduced. Similarly, CYP3A4 enzyme inducers like carbamazepine, phenytoin, and phenobarbital may increase the metabolism of buspirone, requiring an increase in its dose. Now let's see the chemical form of buspirone. This is the spiro ring system present in the drug, with ketone groups at the 7th and 9th positions and nitrogen at the 8th position. So it is an 8 as a spiro, 4,5, decane 7, 9 dione derivative. Simply, it is a spiroketone, that's why we can find the suffix spirone within its name. Another heterocyclic ring system is pyrimidine 2-YL-piperazine, which exists as an active metabolite after the metabolism of buspirone. These two ring systems are connected by a butyl bridge. That's why we can observe the prefix Bu in the name of buspirone. So that's the pharmacology of buspirone. Thanks for watching this video. Please don't forget to subscribe this channel and hit the like button. Stay tuned for another interesting video with a new topic. Have a nice day, take care, goodbye.